Question 271, Mandy, an adolescent girl is admitted to an acute care facility with severe malnutrition. After a thorough examination, the physician diagnoses anorexia nervosa. When developing the plan of care for this client, the nurse is most likely to include which nursing diagnosis? A. Hopelessness. B. Powerlessness. C. Chronic low self-esteem. D. Deficient knowledge. Question 271 Answer, C. Chronic low self-esteem. Question 271 Explanation, young women with chronic low self-esteem are at highest risk for anorexia nervosa because they perceive being thin as a way to improve their self-confidence. Hopelessness and powerlessness are inappropriate nursing diagnoses because clients with anorexia nervosa seldom feel hopeless or powerless. Instead, they use food to control their desire to be thin and hope that restricting food intake will achieve this goal. Anorexia nervosa doesn't result from a knowledge deficit, such as one regarding good nutrition. Question 272, which diagnostic test would be used first to evaluate a client with upper GI bleeding? A. Endoscopy. B. Upper GI series. C. Hemoglobin, HB, levels and hematocrit, HCT. D. Arteriography. Question 272 Answer, A. Endoscopy. Question 272 Explanation, endoscopy permits direct evaluation of the upper GI tract and can detect 90% of bleeding lesions. An upper GI series, or barium study, usually isn't the diagnostic method of choice, especially in a client with acute active bleeding who's vomiting and unstable. An upper GI series is also less accurate than endoscopy. Although an upper GI series might confirm the presence of a lesion, it wouldn't necessarily reveal whether the lesion is bleeding. HB levels and HCT, which indicate loss of blood volume, aren't always reliable indicators of GI bleeding because a decrease in these values may not be seen for several hours. Arteriography is an invasive study associated with life-threatening complications and wouldn't be used for an initial evaluation. Question 273. A female client who has just been diagnosed with hepatitis A asks, "How could I have gotten this disease?" What is the nurse's best response? A. You may have eaten contaminated restaurant food. B. You could have gotten it by using IV drugs. C. You must have received an infected blood transfusion. D. You probably got it by engaging in unprotected sex. Question 273 Answer, A. You may have eaten contaminated restaurant food. Question 273 Explanation, hepatitis A virus typically is transmitted by the oral fecal route, commonly by consuming food contaminated by infected food handlers. The virus isn't transmitted by the IV route, blood transfusions, or unprotected sex. Hepatitis B can be transmitted by IV drug use or blood transfusion. Hepatitis C can be transmitted by unprotected sex. Question 274, when preparing a male client, age 51, for surgery to treat appendicitis, the nurse formulates a nursing diagnosis of risk for infection related to inflammation, perforation, and surgery. What is the rationale for choosing this nursing diagnosis? A. Obstruction of the appendix may increase venous drainage and cause the appendix to rupture. B. Obstruction of the appendix reduces arterial flow, leading to ischemia, inflammation, and rupture of the appendix. C. The appendix may develop gangrene and rupture, especially in a middle-aged client. D. Infection of the appendix diminishes necrotic arterial blood flow and increases venous drainage. Question 274 Answer, B. Obstruction of the appendix reduces arterial flow, leading to ischemia, inflammation, and rupture of the appendix. Question 274 Explanation, a client with appendicitis is at risk for infection related to inflammation, perforation, and surgery because obstruction of the appendix causes mucus fluid to build up, increasing pressure in the appendix and compressing venous outflow drainage. The pressure continues to rise with venous obstruction, arterial blood flow then decreases, leading to ischemia from lack of perfusion. Inflammation and bacterial growth follow, and swelling continues to raise pressure within the appendix, resulting in gangrene and rupture. Geriatric, not middle-aged, clients are especially susceptible to appendix rupture. Question 275. A female client with hepatitis C develops liver failure and GI hemorrhage. The blood products that would most likely bring about hemostasis in the client are: A. Whole blood and albumin. B. Platelets and packed red blood cells. C. Fresh frozen plasma and whole blood. D. Cryoprecipitate and fresh frozen plasma. Question 275. Answer: D. Cryoprecipitate and fresh frozen plasma. Question 275. Explanation: the liver is vital in the synthesis of clotting factors, so when it's diseased or dysfunctional, as in hepatitis C, bleeding occurs. Treatment consists of administering blood products that aid clotting. These include fresh frozen plasma containing fibrinogen and cryoprecipitate, which have most of the clotting factors. Although administering whole blood, albumin, and packed cells will contribute to hemostasis, those products aren't specifically used to treat hemostasis. Platelets are helpful, but the best answer is cryoprecipitate and fresh frozen plasma. Question 276. To prevent gastroesophageal reflux in a male client with hiatal hernia, the nurse should provide which discharge instruction? A. Lie down after meals to promote digestion. B. Avoid coffee and alcoholic beverages. C. Take antacids with meals. D. Limit fluid intake with meals. Question 276. Answer: B. Avoid coffee and alcoholic beverages. Question 276. Explanation: to prevent reflux of stomach acid into the esophagus, the nurse should advise the client to avoid foods and beverages that increase stomach acid, such as coffee and alcohol. The nurse also should teach the client to avoid lying down after meals, which can aggravate reflux, and to take antacids after eating. The client need not limit fluid intake with meals as long as the fluids aren't gastric irritants. Question 277. The nurse caring for a client with small bowel obstruction would plan to implement which nursing intervention first? A. Administering pain medication. B. Obtaining a blood sample for laboratory studies. C. Preparing to insert an esogastric tube. D. Administering IV fluids. Question 277. Answer: D. Administering IV fluids. Question 277. Explanation: IV infusions containing normal saline solution and potassium should be given first to maintain fluid and electrolyte balance. For the client's comfort and to assist in bowel decompression, the nurse should prepare to insert an tube next. A blood sample is then obtained for laboratory studies to aid in the diagnosis of bowel obstruction and guide treatment. Blood studies usually include a complete blood count, serum electrolyte levels, and blood urea nitrogen level. Pain medication often is withheld until obstruction is diagnosed because analgesics can decrease intestinal motility. Question 278. A female client with dysphagia is being prepared for discharge. Which outcome indicates that the client is ready for discharge? A. The client doesn't exhibit rectal tenesmus. B. The client is free from esophagitis and achalasia. C. The client reports diminished duodenal inflammation. D. The client has normal gastric structures. Question 278. Answer: B. The client is free from esophagitis and achalasia. Question 278. Explanation: dysphagia may be the reason why a client with esophagitis or achalasia seeks treatment. Dysphagia isn't associated with rectal tenesmus, duodenal inflammation, or abnormal gastric structures. Question 279. A male client undergoes total gastrectomy. Several hours after surgery, the nurse notes that the client's nasogastric tube has stopped draining. How should the nurse respond? A. Notify the physician. B. Reposition the tube. C. Irrigate the tube. D. Increase the suction level. Question 279. Answer: Notify the physician. Question 279 Explanation. A NANG tube that fails to drain during the postoperative period should be reported to the physician immediately. It may be clogged, which could increase pressure on the suture site because fluid isn't draining adequately. Repositioning or irrigating a NANG tube in a client who has undergone gastric surgery can disrupt the anastomosis. Increasing the level of suction may cause trauma to GI mucosa or the suture line. Question 280. What laboratory finding is the primary diagnostic indicator for pancreatitis? A. Elevated blood urea nitrogen, BUN. B. Elevated serum lipase. C. Elevated aspartate aminotransferase, AST. D. Increased lactate dehydrogenase, LD. Question 280 Answer. B. Elevated serum lipase. Question 280 Explanation. Elevation of serum lipase is the most reliable indicator of pancreatitis because this enzyme is produced solely by the pancreas. A client's BUN is typically elevated in relation to renal dysfunction, the AST, in relation to liver dysfunction, and LD, in relation to damaged cardiac muscle.